another episode of Reading with Elsie. Today, we're doing a discussion on childhood cancers based on the story we read on our last episode. Today, I have with me a doctor and a very good parent. So, we're here to teach you more about childhood cancers, and we're here to encourage you as parents to be more particular about your child's health care. So, doctor, you would introduce yourself, and then parents, you tell us who you are.
My name is Elikem Kumahor. I'm a medical doctor at Olivet Teaching Hospital. My interests are working with children and also pathology. So I'm currently working in the Department of Pathology.
Yeah. And I am Olivet, also Obeng Boateng, a parent, and I work with Olivet.
Thank you very much, and thank you for gracing my invitation. So we'll go right into the questions, starting off with Dr. Kumahor.
Yeah.
So, doctor, what is cancer?
Okay, so I would have to explain a little bit what cancer is, because the definition might be a bit cumbersome. So our human bodies are made up of cells, and these cells undergo what we call a life cycle or a cell cycle. So these cells have a point in which they come into existence and then they divide. So each cell has a finite amount of time it divides. Then the cell will go into rest, which we call the quiescent state. From that point in time, the cell can die. What happens with cancer is that these cells in the body undergo certain changes in their genes, their genetic changes, and because of these genetic changes, the cells lose their ability to control their division. So these cells begin to divide out of abnormally, and what actually happens is that they divide, there's no control, so they just keep dividing, they just keep getting bigger and bigger, and they also lose their function. So for example, if the cell is in your eye and is responsible to help you see, when they lose that genetic control, they lose that ability to help you see, and then you lose function in that part of the body where the cell is dividing abnormally. So cancer basically has two main characteristics. First, these cells divide abnormally and they tend to extend and encroach on other normal cells around them, which we call invasion. And the second thing about cancers is that they have the ability to spread to distant sites of the body, which we call metastasis. So cancers mainly have two properties. They first invade, they try to encroach on areas where they've not been invited. And the second property is that they are able to spread to distant sites. So that's basically a cancer. It's simply an abnormal growth in a part of a body which encroaches on the surrounding tissue where it's not supposed to be and has the ability to spread to distant parts of the body to cause problems.
That's very insightful.
Yeah.
Why do we have childhood cancers? How different is childhood cancers from the cancers we know?
Good. So cancers can occur in any person, child, adult, even babies in the womb can begin to develop cancers, because the problem with cancers is an abnormal regulation of the cell's ability to divide. This can happen when it can be acquired, so you can acquire it from an infection. Some people acquire cancers from smoking, the lung cancers, and also you can have it as a congenital problem. So it can be something that you are born with in your gene that would manifest itself maybe at birth or maybe in an older age. So as for cancers, they cut across. But to answer your question properly, there are some cancers that typically occur only in children because these cancers are more genetic and congenital. Congenital means that you are born with it. So the problem is a congenital problem. It's something that happens to you when you're in your mother's womb. And there are other cancers that you catch from the environment. For example, cervical cancer, which you get from an infection, and lung cancer, which people usually get from smoking. You understand? So there are cancers you can get which are more common in children. There are cancers which are more common in adults, but basically both adults and children can have cancers.
How severe is a cancer in a child relative to an adult?
Okay, it's a good question. So it actually depends on the type of cancer we are talking about. There are so many different types of cancer. Even in one organ, you can have about 80 different types of cancers. But the good news is that for children, cancers usually have a better prognosis. So basically, prognosis refers to an outcome of an illness. So you can have an illness that would have a good prognosis, meaning that it is likely it can be cured, and then you would have long-term survival rates. And then you can have a cancer that has a bad prognosis, where when you get it, there isn't really much we can do about it because we really haven't found cures for it, and they are really aggressive. So in children, what we tend to find is that most of their cancers have a rather good prognosis because God loves them, and because also they are growing up. There are a lot of things that can be done to modify how these diseases work. Yeah.
All right, Mrs. Obeng Boateng. So you're a parent, and I, knowing you, know how particular you are about your child's health care and how you learn and treat some of these issues if you see certain signs or symptoms. So can you share with us how you pick some subtle cues in your child getting sick? How do you know that this child, there's something wrong?
Alright, so like you rightly said, as a parent or as a mother, you know your child best. You know how well your child feeds, you know how well your child plays, when he meets his contemporaries, how actively he engages in the activities that go and all that. So once you see certain changes, you should begin to ask yourself some questions. What is happening? Is my child getting sick, or is he just growing and so would want to remain calmer? Or you would be asking certain questions you need answers to. If your child is the hyper type, he wakes up in the morning and then it's like he hasn't taken anything but he's jumping around, kicking things. You give him food in like 30 minutes, he's able to finish everything in the next 2 hours because he's dissipating a lot of energy, and so he's hungry, he comes, "Mommy, I want to eat," and all that. And then all of a sudden, or with time, you notice things are not the same anymore. He wakes up in the morning, it's difficult for him to get out of bed, he has body weakness, you give him food. Before he would take like 30 minutes to finish the food, but now it's taking him ages to complete the same quantity of food hitherto would have been done in like 30 minutes, or he just doesn't want to eat at all. You would want to find out why. Yes, children change with time, but when you have a multiple of these changes going on, coupled with probably elevated temperatures and all that, you would tell yourself, no, there's something happening. My child is getting sick. So I wouldn't want to disregard these changes. I want to seek the expert's advice on what is going on. You don't wait till the child gets very sick before you visit the doctor. Once you see these changes going on, you would want to immediately seek the expert's advice.
For you, how sick is sick for you? How sick is very sick? How sick calls for let's go to the hospital? Or how sick is, oh, let's just pass by the pharmacy and get something?
Alright, so for instance, with the changes I spoke about, if my child is not eating as much as he used to eat, probably I would think it's because the food I'm presenting him with, he doesn't like it. So let me give him something else. Children like ricey stuff and all that, so let me present something else. If he's still not eating, okay, it's just that he's lost appetite. Let me just do some multivites or some iron tabs and all that. You get me? If it is about headache or body pains or something of that sort, I would go in for painkillers. But if these changes or these conditions are accompanied with vomiting, diarrhea, swelling here and there, rashes and all that, I would want to seek the medical doctor's advice. I wouldn't want to attempt to treat or handle these in any way.
So if a headache persists, if she has a headache or he has a headache, and then you give him some paracetamol or something and he feels better or the temperature goes down, and 2 or 3 days later it comes back, does that call for a hospital?
Yes, it does, because then probably there's a certain medical condition in there that is manifesting itself in the headache you are seeing. You get me? If it's just a body pain or it's just tiredness that is presenting itself in headache, once you get the person the painkiller, the person should be fine. But if it's recurring, then there probably might be a certain condition in there that is presenting itself that way. So you surely need to see the doctor to do more labs or further tests to see if there is something in there. Yeah.
Dr. Elikem,
Yes.
at what point would you advise that parents take their children to the hospital, and with what symptoms? When do you think it's okay to, or don't waste your time coming to the hospital, just visit the pharmacy? Or when do you think it gets him right to the hospital at that moment? How would you advise parents on some things like this?
Okay, so from what Mommy said, Mommy was describing some things, and I think that in our practice we call them the warning signs or the danger signs, and Mommy rightly mentioned most of them. She spoke about a high grade fever, she spoke about vomiting, she spoke about diarrhea. So those are warning signs that tell you that whatever is going on cannot be managed at home, and you shouldn't waste time and come to the hospital. But at the same time, there are some subtle changes, and Mommy rightly mentioned, usually for the subtle changes, if it's maybe short period and it gets better quickly, you do not need to come to the hospital. But as Mommy rightly said, if it becomes recurrent, so the loss of appetite has become recurrent, the child looks down and it's been there for about 3 days, and especially with when you talk about children, okay, you are looking, or child health, you are looking at a spectrum of different groups of people who communicate very differently. So you have a neonate, someone who's been born and is in the first month of life. They are very different from an infant who is between the second month of life to the first year of life, and they are very different from toddlers who have started walking, or they are crawling and then walking. They are very different from young adults, they are very different from old adults, and they are even different from adolescents. So you would realize that between young and older childhood, they voice out a lot. Mommy, my hand is paining me. Mommy, my head is paining me. They will tell you, and then you know what to do. Adolescents will hide it. You see, neonates and infants might not be able to voice it out. So how you pick up changes in these different age groups changes with time. So a neonate who is not breastfeeding and crying a lot, it tells you something. The baby may not have a fever, especially for the neonates and infants. The baby has stopped breastfeeding, the baby is crying a lot. There is no fever. That baby might actually be in deep waters and has to see the doctor. An infant who was crawling and all of a sudden has stopped crawling, even that one alone, the baby is eating all right, but the baby has stopped crawling. That one too is a danger sign on its own. Do you understand me? I work in a children's hospital sometimes, and sometimes the parents would bring what you would say is a very flimsy complaint to the hospital. Doctor, I realize that my child's breath has changed. You go and look in there and maybe there is some serious infection going on in the throat. But that baby is about 18 months old. And the baby is not voicing anything out at that age. But that's very subtle complaint. It's leading you to make a diagnosis. If you miss it, you would actually cause the problem to aggravate and become something that it's not. Because we are talking about cancers, I just wanted to zoom in on cancers, because usually in children, across the age groups, cancers can be very evasive. The first thing is that they are not too common. They are not too common, okay? Children, when I was working in Confanoche, because it's a referral hospital, they will come and the diagnosis has been made because they are coming from very far away. When I started working in the city, it's maybe once or twice we've picked something like that up. So usually for such children, there are some of them that are very clear. Parents will notice that a part of the child's body is swelling. Children fall and they may break their limbs. They are very playful, so they may fall and they may break their limbs. So they will come to the hospital. We'll take an X-ray. If it's a fracture, we will see it. If it's a soft tissue swelling, we will see it. But when you begin to see that the bone itself is beginning to look funny, then you realize that maybe this is something going on in the bone, and then your signals are up. So you see, for swelling, some of them come and they'll tell you, doctor, my baby's eye is becoming white. You have to pick it up. Baby's eye becoming white. Maybe there are some abnormal cells growing in there. Then you quickly refer to see the ophthalmologist who can look into the baby's eye properly. The very classical one that a lot of parents miss and even doctors miss is when the babies keep getting recurrent infections. So you realize that the baby goes to the hospital. This week it's a fever. Next week, fever. Next week, fever. The baby is getting weak. Child is not growing, losing weight. Child doesn't seem to be walking when they are supposed to, talking when they are supposed to. But you realize that there are a lot of fevers going on. Today fever, and they'll go, they say that the child's blood is low, the hemoglobin concentration, the HB is low, or what the mothers will say, pneumonia will form. One of the most common childhood cancers are the blood cancers, the ones we call the leukemias. And they are very, very subtle. Most of the time, it's a gradual decrease in your blood levels and your white. The white blood cells are supposed to fight infections. So when they start going down, you begin to have these fevers. You begin to experience these recurrent fevers, and the child is always tired, and the child is not eating well. So usually, when you begin to pick up these things, 1, 2, 3, it's very important that you go deep and you evaluate, you do some advanced lab tests to find out what is really going on. So as I'm saying, some of the symptoms can be very obvious. They will jump at you. The child's knee is getting bigger. In 3 days, the knee has become like this. There's something going on. It's very obvious. Some of them too are very subtle. Very, very subtle. And it will take multiple hospital visits. And it's not because the doctors are not good. Sometimes the symptoms are so subtle. Because if you come to me with a fever and I tell you, go and do a very expensive lab test, and you come back and it's negative, you will be upset. You understand? You go and do 2,000 Ghana cedi lab test. Yeah, the doctors listed by the doctors on one back. But if it comes 1, 2, 3, I'm like, madam, let's do this. Even if it's negative, at least we are both at peace. Now, whatever is going on is not dangerous, you see. So those are my few thoughts. I've answered your question
Maybe. Is it okay? I don't know what happens with your practice, but is it okay to let the parents know that with the recurring fevers or infections, there could be something like that lingering around? Is it okay to give them a heads up, or you keep that to yourself and keep cheating them until they do the test and you both find out? I mean,
so in child health or in pediatric practice, you don't just treat a child, you are treating the parents too. And in pediatric health too, the parent is the primary caregiver. Okay, so if the child has been coming to the hospital for about 2-3 months with symptoms and you are beginning to think it's a cancer, it's very important for you to tell the parents what you think it could be. Yes, they may get anxious, okay, but it's always good to let them know that this is what I'm thinking about. That is why I'm going to do this test that you are going to pay for. So if it's there and it's correct, let's prepare our minds because this is the solution. But if it's not there, hallelujah, we can look for another cause of it. Do you understand what I'm saying? So basically, it's very good to let the parents know throughout the treatment process that whatever you are doing is for a reason. There are many times that in especially in our public health facilities, you go there, you'll be there for 2 weeks, and someone will ask you, what did the doctor say is wrong with you? I don't know. Did you ask the doctor? Yes. What did he say? I really don't know. Which is wrong. You're supposed to know what is wrong with you so that you can give consent to the treatment you are being given. It's very important to update the mommy, this is what we found, this is what we are going to do, this is what we think it is. And in our practice, we are trained to be as professional but as honest as possible to the parents. Because at the end of the day, if you all of a sudden they've been in the hospital for 6 months and then you pop up and tell them that, oh, we realized that your child has a cancer, and then we don't have a cure for this cancer, your child has 2 months to live. How do you think the parent will feel? Do you understand? It's different from right from day one. Mommy, we did this test, it's not an infection. We are beginning to look for markers of cancers. Then after 2 weeks, mommy, we think it's a cancer, but we've picked it up early. We can start some treatment. Then mommy knows that treatment is going on. She's praying, she's, there's stress involved, but she's there. Then she sees it for about 6-7 months. She knows that, oh, this thing, the doctors are doing their best. I'm doing my best, but we are not getting results. Mommy, this is what we are going to do. So you prepare the patients and their parents for the process if it is a cancer. And luckily in children, cancers are curable. 80% of them are curable. 80%? Yes, it's a high value. There are some of them that are not curable, but most of them are.
How expensive would you say, not just in monetary value, is it for parents to, or for childhood cancers to be treated? How expensive is it? Like I said, not just in monetary value. How much are parents going to be expending if they don't pay attention to the subtle symptoms and don't report their children's symptoms early at the hospital?
It is so the straightforward answer to your question is that it's not cheap. It's not cheap financially, it's not cheap emotionally, it's not cheap psychologically. You see, sometimes parents whose children are diagnosed with cancer, sometimes one parent has to stop working and be at home because these children can get very, very, very sick. Like very, very sick. They will not be able to feed themselves. Children are already very helpless most of the time. You have to help them dress. You have to feed them. You have to, so imagine a child who is sick. It needs a lot of attention. I have personally even had my own share of emotional breakdowns from caring for very sick children who had cancers. And I mean, sometimes you go back to your room and you also go and cry because it's like, it's difficult, it's expensive for doctors. And I remember, especially in Confanoche, where we trained and we worked a little bit on the children's ward, sometimes doctors have to, during ward rounds, doctors will have to do a silver collection to support some of these children, because it's really sad to see that this child hasn't really done anything, and so it's expensive, not just for the parents, for the family, for the hospital. Everybody gets involved. But the good news is that when it's picked up early, okay, it makes things easier for us. But even when you pick it up early, sometimes it still gets expensive along the line. So I think that it's not easy. That one day I will not sugarcoat anything for any parent. Yeah.
It's important that you don't sugarcoat, because I want everyone to appreciate what it means if you don't pay attention to your child's health care. So moving on, starting off with Ursula. So I know adults who go for timely checkups at the hospital. How often do you think children should have these? They're not showing headaches, there's no tummy ache. Just think, oh, let's pass to the hospital and make sure you are okay.
Alright, so routine medical checkups in general are good, irrespective of your age. Whether you're a child, whether you find yourself in the middle age class, or you are an adult, it's good to do regular medical checkups. The essence is if there is anything that is happening which is not yet evident on you, it's seen early. And like Elikem rightly said, early detection is key to having to solve the issue right on time. So it's funny how in our part of the world people associate checkups with the aged. It's like they are growing, and so they are likely to be developing strange diseases and all that. So somebody hears you are sending your child to the hospital for a medical exams, and then it's so absurd to them. Well, what is wrong with you? The child is not complaining, he's sick, she's sick, and you are sending the child for checkup. But it's good, it's a good thing. It actually creates very good grounds for proper growth and development in the child. So, is anything happening in the child? Let me just link it to the childhood cancers. These cancers would be presenting themselves in, there will be some indicators or some pointers that would start in the children. So you send your child to the hospital for just a routine examination. They do some lab works, they check on the urine, you have something, routine urine examination or all that.
Yeah.
There may be some elements or certain changes in the blood works or in the urine, and they will pick on these changes and say, okay, probably the blood level or the platelets or whatever, all your terms are low or are not in range. So, okay, let's do a further diagnosis to see if this is happening or that is happening and all that. If they do all that and there's no cause for alarm, you are good to go. But if they do and there is something, it's pointing to another thing, they'll go on and then would see that thing, and then quickly they put the child on a certain treatment regime. So it doesn't even escalate to a point where it would result in something serious. So it's good we as parents inculcate that habit of sending the children to the hospitals for examination, so that if there's anything, it's seen in good time and then it can be kept. So I think twice a year is fine. If the child is not showing anything, twice a year is fine. First half of the year, you send the child to the hospital. They run a thorough examination on the child to see if everything is okay. And then the last half of the year to do same, so that if there's anything, it's seen in good time and then something is said about it.
Say for you, Dr. Elikem, one, how important or at what times do you think these child checkups should be done, examinations should be done? And again, do our systems allow for some of these things to happen?
Let me answer the second one. So yes, you see, our system actually has made provision for children to be checked up. In fact, it's almost a law now. And I said that if childhood is defined in a very long, a lot of years. So I'm sure if you went for weighing and vaccination, those are checkups. Those are actually checkups. So at birth, 6 weeks, 14 weeks, 6 months, on and on and on and on. So as Kofi is being checked up, we are checking the weight, we are looking at a few things, then we give the shot. And we are mapping the child's weight. So the system actually has, and when you pick the child welfare card or the child health record book, that's what's called. When you pick it, the mandatory record checking is supposed to be up to 5 years. I'm sure, but usually after 2 years, when they're not giving the vaccine anymore, all the parents find some corner and hide because it's very stressful. And you have a lot of new mothers, and you can imagine the queue that will be there at that time. But you have to keep weighing your child. The child starts running. When you go, there are a lot of things we chat. Is the child walking? There are a lot of questions we ask. And that's how you can monitor your child. So those are the routine checkups. So after the age of 5, then you know that if the child is fine, the child is now growing strongly. And as Mommy said, you can do it twice a year, which is awesome for us. First of all, you get to know what your child is, and you also get some money. And then, well, children. Yeah. But that's just by the way. But as Mommy said, the second question was.
Okay. So, with your experience, you're in the hospital setting. How much attention do you think parents are giving their children? Do you think parents are not doing enough when it comes to paying attention to some of these symptoms, or do they come in too late? Do they come in too early? Do they come to worry you? Do they how much attention do you think parents pay to their children, Ghanaian parents?
Oh, we cannot generalize.
On the average.
On the average. So there are some parents who are very fast. It's like, okay, oh, my child's tooth has come out, okay. Yeah, and there are some too who are very laissez-faire, who would generally not come to the hospital until the child is on the way to the grave, So there are two equal. But I can talk to you from the socio-economic perspective. I realize that usually in the urban areas, some like in Tema, parents are very conscious and they will bring their children to the hospital very, very often as possible, to make sure that this child is fine because of education, because they have access to some of these things. In the less or in the rural areas, you see a child Frank Koscioko living on the road. The mother doesn't even know that this child has Koscioko. Frank Koscioko. And so it depends on where you are, but generally, because of the child welfare clinics, the wheel clinics and other things, I think that the health-seeking attitude of Ghanaian parents is fairly good. In fact, sometimes the clinics can be overwhelming with children. I realize that parents are really conscious about their children's health and they want to know more. And they also do well with reviews. Oh, even if the child is fine, come after a week. Let's see the child. The parent will come. She knows that this child has recovered, but the parent will come so that the doctor can repeat the test and make sure adults, they will come. Oh, I'm fine. I'm going back to work. So I think it's bravo. Congrats to parents. They're doing well.
I'm excited. That's very positive.
Yeah.
So wrapping up, let's close up with you, Mrs. Obeng Boateng. What's your advice to parents? Even though Dr. Elikem says parents are doing well with checkups and reviews, we still have cases of children dying from childhood cancers and dying from other diseases. What's your advice to parents with regards to paying attention to your children and then giving primary health care to their children?
Alright, so in answering this, it will just be a summary of what we have said. As parents, we should be very good observers when it comes to the health care of our kids. We shouldn't disregard certain changes we see in the way they do things. Anything we see which is a deviation from what they used to do, we should try and note them and then seek the experts' advice. I remember some time ago, I was late in picking up my boy from school, and so I sent somebody to pick him up. And normally when they close, there are certain benches they sit on to wait for their parents, and then there is a playground as well. You will never get there and then find him sitting quietly on the bench. He's always playing around, even when you advise him to be sitting and waiting. Whatever time you would have to come and pick him up, you would have to be there waiting. You will never meet him there. So I had to send, I was engaged in some activities in the office, so I had to send somebody to pick him up. I told him, when you go, don't bother yourself looking where the benches are. Just go straight to the playground and then look for him. He went there and wasted so much time there. He wasn't finding him. He called me. I'm not finding him there. I said, he's always there. But later, he found him sitting quietly on the bench. So when he called me to tell me about it, I was like, wow. Anyway, I think this boy is changing. It was when I came home that I noticed he had hurt himself. That is why he was sitting quietly somewhere. Because that is not him. I know him to be the hyper type. He is always on the move. So once there's any change, you probe and you realize, no, there is something wrong with my boy. So, like I said, you are the best person to know your child. You know him best. If he's the very active type and all of a sudden he is down, they change. Children change as they grow, they change on all things. But then if these changes are accompanied with other pointers or other indicators, you shouldn't disregard them. You should try and then talk to the doctor. This is what is happening to my child. He eats well, but now he doesn't eat so much. He is active, he plays well with his peers, but now it's no more and other questions the doctor may want to find from you. You see, once we report these changes, the doctor would want to do certain tests or would want to go into it to find out if there is really something happening. Probably it's just a normal thing. They are growing, and so there are certain changes and all that. It's fine. But if there is any condition or any health challenge that is beginning to develop, it is seen in good time so that they put the right intervention in place so it doesn't escalate into anything unfortunate. And since we are discussing childhood cancers, I would want to add that I believe September is the month for the awareness, but I am not hearing much. Unlike other cancers, the breast cancers, the prostate cancers, cervical cancers, and all that, I think next month will be the month for breast cancer awareness. You would see the sort of education that would go on radios, on televisions, social media, things going viral and all that. These are what we want to hear when it comes to childhood cancers. The farmer sitting somewhere, the trader and all that, they are not hearing about this kind of disease. So in the event any of their kids is diagnosed of the disease, even the psychological trauma is enough to break the parents down. So the parent is not strong enough to go through the ordeal with the kid. So I think, yes, we are doing much as an expert, Elikem and your colleagues, you are doing so, but you should try and intensify awareness, the education on these diseases, so that when they even get to it, where they get to that point, they know, after all, they are not the first people to be experiencing it. Somebody has gotten there before, and the person probably survived it, or the person went through it this way and that way and all that. And so the just the mention of the disease doesn't just break them down. We should try and then increase the education so everybody gets to hear about it.
Thank you very much. Thank you to you too. I'm very grateful for your time and for all that you've shared. Would follow up this discussion. Yesterday, Dr. Hepzibah Oshremensa had a live discussion with Dr. Ado on childhood cancers. I'll leave the link in the description section where you can follow up discussions on childhood cancers. Please share this video as far as it can go. Share. And like, follow, subscribe to our YouTube channel for more, and catch you again on another episode of Reading with Elsie. My name is Elsie. I've been discussing with Dr. Elikem Kumahor and Mrs. Olivet Obeng Boateng. Bye.